I think the biggest challenge for Global Alliance really impacting healthcare globally is that in genomic research, we have a long tradition of international collaboration, all the way back to the Human Genome Project and before. So whereas healthcare is incredibly local, whether that's in a city or a state or a region. And so for Global Alliance to really bring the power of genomics to healthcare, we can only do it through initiatives that are grounded in healthcare, like ICPerMed and others around the world that are focused on benefits in health, pulling genomics in. So without that collaboration, the benefits of genomic science will never actually reach healthcare. We have to collaborate. I think public trust is incredibly important, and the challenge with it takes a long time and a lot of really consistent behavior to build trust, and it can be lost very quickly. I think particularly when it's people's health. I think the most important thing that health systems and others can do in an age of AI and large-scale health data is be very transparent, very open, and consult with publics ahead of time as to what is critical, the benefits of data sharing, the benefits of personalized medicine, but most of all, be transparent, be consistent, and think about it from a patient perspective. So I think when we look at the issue of patient-centric healthcare, which is at the basis of personalized or precision medicine, the important thing is to think of patients as individuals, but also as groups. And some of the best work we've seen done has been by patient groups, particularly in areas like rare disease and cancer, where people come together as individuals, as families, and they create advocacy, they create agency that's beyond an individual patient, but it's a group of patients that can articulate their real needs and benefit others, not just with their disease, but with many diseases. When we see the broader question of why people trust or their perspectives on DNA, there's a great survey done by Anna Middleton from the Sanger Institute on Your DNA, Your Say. And they've looked at many different countries and general public, and we find that the more people understand about DNA, truly understand, not from a movie or CSI, but the benefits of DNA in healthcare, the more willing they are to share their data and participate in research. So I think it's individual patients, patient groups, and public trust. So one of the big challenges for Global Alliance over the last 10 plus years has been living up to the global in our name. It was relatively easy to form a collaboration of advanced countries doing genomics at scale and come together and do even better and develop the standards that everybody needs. It was more difficult for countries with emerging genomic research or healthcare to participate in standards development. What we've done in the last 5 years is establish communities of interest around rare disease, cancer, infectious disease, neuroscience, clinical labs. But perhaps most important for countries in low middle income countries or limited resources, emerging programs, is created what we call the National Initiatives Forum. It was initiated by Genomics England and Australian Genomics, but today it's over 25 countries, many of them just starting their precision medicine or personalized medicine journey. I was in Indonesia last week, and 7 of those countries presented their program on genomic medicine or personalized medicine. And so they can come in as implementers and adopters of Global Alliance and tell us if our standards, our policies work for them in the real world. So maybe it was a challenge to get involved in the beginning, but we're increasingly seeing participation from many countries as they develop their personalized medicine systems. When we started Global Alliance 10 plus years ago, it was very much about genomic research, but from the beginning, it was never about bigger, better genomic research. It was always about making that research have impact and benefit for patients and healthcare to improve human health. So that's been our journey. The challenge is the local nature of healthcare, the way it is part of a society, part of their culture, And so in order for genomics or any other form of modern science to impact healthcare, it's got to recognize the systems that are in place. It's got to work with established networks of healthcare providers, of patients, of funders of healthcare. So for Global Alliance to have an impact in areas like rare disease, cancer, polygenic risk scores in terms of prevention, newborn screening, prenatal screening, pathogens, and understanding how a host, pathogen and the host interact. For all of those clinical impacts that Global Alliance could have, it can only do it in collaboration with healthcare systems, initiatives like ICPerMed, and also other standards groups like ISO, HL7, HL7 Fire. So as genomic standards coming from research meet healthcare, they've got to work within the existing healthcare systems and evolve with them.